Hi guys, and welcome back to my channel. If you're new, make sure you hit the subscribe button and turn on your notifications. This is part 2 of recovering from a Septoplasty Bilateral Submucous Resection Inferior Turbinates surgery. If you haven't checked out part 1, then make sure you click on the link below and check that out so you can be up to date on days 1 through 5 of recovery. And today I'm going to cover the rest of day 5 from recovery and a couple days afterwards.
Horrible day today. Massive headache all day. My tongue's been bleeding. It looks like it's cut straight down the middle of my tongue.
Show us. Very nice.
I don't know how badly it looks right now. It doesn't hurt that bad right now. It's just been an annoying day, to say the least.
What else has been annoying about it?
Haven't really been able to sleep until a couple hours ago. Waking up and my tongue's bleeding is pretty annoying. Nose feels clogged up still. Mouth is still numb. Can't really eat anything without my tongue burning.
Did rinsing your mouth out with peroxide help, or
No.
rinsing it with the salt water? That didn't help?
Rinsing it with peroxide didn't do anything. Rinsing it with salt at least like soothed it a little bit.
So you feel pretty disappointed so far and let down, kind of.
I don't know about that. I'm just annoyed.
Any other emotions you feel during day 5?
No, just flat out annoyed.
For brunch, Clayton's been having a smoothie, a frozen fruit smoothie that consists of all these lovely, delicious items. Look at this deliciousness. Oh yeah.
Hi.
Smoothie coming right up.
Thank you.
Tell us about day 6.
Oh, better than day 4 and 5 for sure. I haven't had a massive headache. Still feel really congested. When I do my rinse, I still get blood out, but it's not as runny. It's more clumpy. It's more in like big clumps they come out in just big clumps at a time. Oh man, definitely hurts.
What does the pain feel like? Can you describe it?
It feels raw. It's just like if you touch it, a lot of work was done. Like it just feels really raw. It went through a lot. I feel like I've had enough energy to be able to stand up for 5 to 10 minutes without getting filled up with blood really quickly and feeling like I have to lay down. Whole congestion thing is uncomfortable because when I do my rinse, like I might do the rinse when it feels clear, but then after I do the rinse, it feels congested.
So you've been using the Neil Sinus Med bottle and just putting distilled water in it and just flushing it out that way without the saline mix in it?
I'll put the saline mix in if I do it and then it feels congested right after it, then I'll fill it up with just water and do it again through like one of the nostrils to clear it out of, like for example, I'll do it just in the left and clear it out through the right.
To clarify, Clayton is still doing the NeilMed sinus rinse 3 times a day like he's supposed to. He actually started off doing it 2 times a day, but then the PA said that he can do it up to 3 times a day, so he started doing it 3 times a day with the sodium bicarb and sodium chloride solution mixed into the NeilMed bottle with distilled water. But what he's talking about, just rinsing it with the distilled water, he's just filling up the NeilMed sinus rinse bottle, putting distilled water in it, and just rinsing his nostrils out as many times a day as he wants, because the water can't really harm him or do any harm, but it does provide him some relief for a temporary period of time.
Definitely still need pain medication. I've been taking Advil and Advil PM.
Does the Advil PM help you sleep at night?
Yeah, for sure.
Another thing we learned from Clayton's post-op appointment is the amount that we've been putting of his mupirocin on the swab for inside his nose to prevent the bacteria from growing inside of there. The amount we were putting on there was not enough because the PA put on a whole lot more. So this is the new amount we've been putting on his nose. You can see it's globbed up on there. So much.
Whenever the right side starts to feel clogged up, that's when my head starts hurting. All right, here we go.
Here we can get a closer look at his nose. How's your tongue feeling today?
Still pretty dry, but not as painful.
Do you have a headache?
Yeah, a little bit, yeah. Not too bad.
That's what just came out of his nose as he was doing his NeilMed sinus rinse. He just finished the nasal saline rinse, and I want to show you the inside of his nose before he puts the mupirocin swab inside. You can see the stitches right there. It is officially exactly 1 week after your surgery.
Yeah.
How are you feeling?
I'm feeling like it's definitely a turning point. I'm feeling a little bit better. I can get up and move around a little bit. I have to be reminded sometimes that I'm not supposed to be because
Rest is important for recovery.
I've been moving around a little bit, trying to keep it minimal and still, keep my head propped back some. Feel pretty good. Little pain in here still. The nose still hurts. And not as much headache. I only get a headache if I get clogged up. I just did the sinus rinse a second time and I can breathe through the right side pretty well. Left side's still kind of clogged up. All in all, it's good. Also, before my surgery, I did smell tests. I couldn't breathe through I couldn't smell dangerous smells through my right nostril, which is pretty important for function. Now I'm able to smell myself even when I smell bad. When the left nostril's clogged up still, that's pretty exciting. They made the incision on the left side only because the surgeon said it was easier to access through the left side to get into the turbinate and the pieces that they had to straighten out. See, even coughing doesn't really hurt as much. I still have to be ginger with it. Day 8, definitely the best day so far. I felt like I've had more energy. My rinses are still effective. I'm still sticking to everything that they're telling me to do. Victoria's not around right now, so I figured I'd make the video right now. I'm able to put down more food now. I have this on because I just did a rinse and I put the liquid stuff in there so I could, keep it from dripping out. I'm able to do a little bit more myself. Yep, so far it's a good day. By day 7 and 8, I'm kind of dreading laying down, ready to get moving and ready to get back to regular daily life. It's a little tough. Dress and little things are more to react, and that's part of it.
Day 9, Clayton is up and vacuuming, pushing the couch over. Are you experiencing any pain as you're vacuuming?
Yes, my nose hurts.
What does it feel like?
It feels like really sore. If you hit something on something really hard and then the days after it feels sore, that's what it feels like. It just feels really sore.
Did the soreness occur before or after vacuuming?
Before. It was already sore. Ever since I woke up, it was sore.
We have Clayton Ganaway here, and he's going to tell us how day 9...
Alright. I kept up with it while you were gone, right?
I saw that. I'm so proud of you.
I would say I feel pretty good. However, you have to make sure you keep up with everything that you have to do, because if you don't, for example, forget to take the sinus medication, you'll feel really congested anytime you do the rinse or put the ointment in, whatever. You'll just feel extremely congested, because that's how I feel now. This morning I was like, I'm good. I don't need to take sinus medication. I feel fine. But then now I'm feeling the consequences of it, and I just took one a little bit ago because it was bad. Also say just keep up with your stuff. Make sure you keep up. Day 10, I would say same thing. Make sure you stay on top of taking what you need to take and doing what you need to do with rinses and stuff. I stopped taking pain medication and now I'm really feeling it. Today was the first day I kind of went out and about doing things. It was a good day driving. I definitely felt a little bit slow, but nothing extreme. Yeah, just make sure you take pain medication when you need to.
Thanks for tuning in, and make sure you hit the subscribe button.